So I'm going to introduce you to a concept that is absolutely critical that I don't think many people understand. I think everyone understands disease. Disease is a major problem with the body. And if you've had or been diseased over your past, you know exactly what that means. So once there's disease, and it doesn't matter if it's kidney disease or heart disease or lung disease, well, we have a problem in the body that is very difficult to peel back and restore full health. We know this. And on the other end of the spectrum is really good health. So we have great health on one end, we have full-blown disease on the other, and that goes for every organ, gland, and tissue in the body, right? So you can have heart disease, lung disease, you can list them off. Now, the concept I'd love you to take home today is what happens when you don't have a full-blown disease process is what I call in this office dis-ease. D-I-S-E-A-S-E. I'll just spell that for you one more time. D-I-S-E-A-S-E. And dis-ease simply means that there is 1,000 shades of gray. There is a continuum between being perfectly healthy and having full-blown disease settle into the body. Now, how does that look in the office technically? Well, when we have someone who comes into the office, a bad spine can develop disease. And you guys know this. You can have degenerative disc disease and you can have degenerative joint disease. And that's spinal arthritis. That is the spine slowly breaking down over time. The precursor to having spinal damage or spinal arthritis is high pressure, high stress, usually for 10 to 15 years, and that high pressure, high stress is what's called subluxation. And we know that. That's a fact. That's the truth about spinal health. So now what is a dis-ease process? Well, a dis-ease process simply means that the spine will take stress and it'll go through a slow, damaging process. And as the spine gets slowly damaged over time, it starts putting increased pressure, stress, and static on the nerve system. So all of a sudden, you're not functioning at 100%. Now, how do you know you have subluxation and a dis-ease process? That's the tricky part because you normally won't until you get the correct exam and, if necessary, the correct imaging. Because the flip side to that is your body is absolutely amazing at compensating and adapting to pressure and stress in your spine, so you can get by perfectly fine for years and decades, not realizing that your spine is getting damaged over time, and also that there's slow, steady pressure building on your nerve system. Now, over decades, you can see how this will go from healthy through a dis-ease process to full-blown disease. Because once we start seeing degenerative joint disease, degenerative disc disease, and pressure on your spinal cord or nerve system, well, now we have a health problem. And that becomes the biggest issue in medicine. It's a reason why, even at the hospitals, they screen for things. Nobody wants to wait for symptoms to appear. Nobody wants for that end organ to be damaged or diseased before we start intervening and moving you to better health. The last point of a dis-ease process is this process can go on for years and you feel perfectly fine. That's why the right exam is the most important thing we can do at any given time. Because the dis-ease process can keep going on for years. You may get a few warning signs. You may, sleep on a funny bed or a funny pillow and get a crick in your neck and then it goes away after a couple of days. You may have headaches that are slowly getting worse over years or decades. You may throw your back out a couple times, your low back, and you think nothing of it. Why? Because with some rest, maybe some painkillers or medications, your back pain goes away. Those are all very obvious examples of a spinal dis-ease process in action. And with the right exam and the right imaging, you're going to see what the structure and what the function of your spine look like, because ultimately, with good structure and good function, you're going to have a healthy spine and a healthy nerve system for as long as you own your spine. And you're going to own your spine for a long, long time, like literally till rigor mortis sets in, you're going to own your spine. So get the right exam, get the right imaging, figure out if you have subluxation and a dis-ease process in action that's going to impact your life and your health as the decades go on. All right, take care. Any questions, shoot me a message.